What was supposed to be a controlled explosion went horribly wrong in a South LA neighborhood. And now families who live there are trying to help their children cope in the aftermath. With the beginning of the school year looming, it is important for kids to be able to heal from traumatic experiences. Our DeMarco Morgan recently spoke with a child psychologist about what parents can do to help their kids move forward.
And we are so lucky to have with us Dr. Karen Rogers, a psychologist with Children's Hospital Los Angeles. Thank you so much and good to see you.
Good to see you too.
So let's talk about this. A lot of kids are starting to head back to school, and we remember the situation with the South LA explosion there. What type of trauma are these kids dealing with?
You know, a trauma is defined as an experience that threatens your safety or your life, and that explosion in South LA certainly was one of those. We know that children of all ages have an emotional response immediately following a trauma, and that some of them over time will continue to struggle with symptoms.
So what are the signs that we should be looking for as parents, as folks who live in the community, teachers, staff?
There are many different ways that children show the impact of trauma. For younger children, it can sometimes show up in their play. So play that sort of in some ways is reminiscent of the traumatic experience that they've been through. Also changes in sleeping and eating patterns. Children may find it more difficult to concentrate and focus in school. They may have nightmares, either related to the trauma or just other nightmares that are prompted by having had a traumatic experience. Basically things that seem like a child is really not themselves over a period of time, and anything that really interferes with what children need to do to grow up to be healthy.
So what's the best way to get help?
The first step is always just to talk about what's going on and to acknowledge the difficult situation that the children have been through and that these families, many of them, continue to be experiencing. Children benefit from responsive relationships with adults who will listen to them and respond to their concerns. And then to reach out. There are a lot of resources for help for families who are looking for more support for children. There may be school counselors, or the pediatrician can be helpful for that.
And I do have a final question. I know the eviction moratorium has been extended to September in places across the country and here in the South Lane as well. Can you talk about trauma that kids may face, not even knowing whether or not they're going to have a place to lay their heads?
Homelessness is a trauma. It's a trauma for adults, it's a trauma for children, and most children who experience homelessness, that path that has led them to that housing instability also has been filled with other traumatic experiences. And so, you know, it's not just the uncertainty that children are dealing with about, well, you know, maybe we can stay here into the school year and maybe not, but it's also the accumulated stress that families have been through during the past couple of years.
And it's going to have a major impact on their learning.
Absolutely. It's really hard to concentrate and focus on school when you are feeling unsafe all the time, uncertain all the time.
All right, Dr. Karen Rogers, a psychologist with Children's Hospital Los Angeles. Thank you and good to see you. I appreciate it.
Good to see you too.